Good afternoon, one and all. Myself, Dr. Rupasri. I'm a consultant in obstetrics and gynecology, Hyderabad. Today, we're going to discuss the topic that is infertility. Some students have asked me regarding the management of infertility. Okay, as infertility is a very long topic, we'll discuss only regarding the management. Okay, let's start. Definition. How you will define infertility? That is, how you will define. It is the failure of the couple to conceive. Okay, failure of the couple to conceive even after the failure of the couple to conceive even after 1 year or more years, even though there is regular unprotected coitus. Okay, you have to remember the definition of the infertility. We'll see. I'm not referring to a male or a female in cause of infertility. It is a couple. It is a couple who should have a baby. No, so it is failure of the couple to conceive even after 1 year or more years, even though there is a regular unprotected coitus. Okay, infertility means there is a combination, that is male and female both are involved and both should be treated. We'll classify it male. Okay, female and unexplained. Okay, in case of male, the chances of involvement of male is 30%. In case of female, it is 45 to 50%. And in unexplained, it may be up to 20 to 25%. Okay, so in this, the questions may be asked like this, that is, how much is the male involvement in case of infertility? It is about 30%. Female involvement 45 to 50%. Okay, unexplained, how much it will be? It is about 20 to 25%. Okay, as I said, it is a long topic. Let us discuss regarding only the management part, and I am more focusing only on the management part of the male infertility. In the coming videos, we'll see regarding the management of the female infertility. See, management. As I said, management we always have the investigative part, investigations, and the treatment part. Okay, in investigations, we'll see regarding the male infertility management in this video. Okay, male infertility management. For investigations of the male infertility, first thing we are going to do is semen analysis, and second is the endocrine profile. Endocrine profile. In endocrine profile, we'll see regarding the thyroid, that is TSH value, prolactin, any hyperprolactinemia, okay, and FSH and LH, that is pituitary gonadotrophins. Okay, next. And the third is semen analysis, endocrine profile, and last is the genetic. In genetic, what we'll do, we'll see whether the karyotyping is normal or not. Karyotyping. We'll see for Klinefelter syndrome 46XYY, that is Klinefelter syndrome. Okay, and any Y chromosomal deletions. Okay, Y chromosomal deletions. We'll see all regarding this. Okay, next. In the investigative part, I have said three important things. That is, they'll ask in the questions, which is the best test to confirm the infertility condition in case of a male is, first you have to answer semen analysis. They'll give a small clue, okay, regarding the semen analysis. Depending upon that, we should find out the answer with what the patient is suffering, okay. Next, we'll see the endocrine profile, and last we go for karyotyping, okay. Next, in case of semen analysis, what we will do? Semen analysis, see, we'll ask the patient to collect the semen sample in a glass jar and report to the hospital within 2 hours. This time is very important. Within 2 hours. Okay, this is very important. And advise the couple for abstinence for 3 days. Okay, advise the couple for abstinence for 3 days and then collect the semen sample in a glass jar and report to the hospital within 2 hours. Okay, this is the procedure. First, they'll ask the question that what you will advise to the patient before semen analysis. First, abstinence for 3 days. Next, within how many hours he should bring to the hospital? That is 2 hours. Now we'll come for semen analysis. Okay, total semen analysis. Okay, now we have come to the lab, you have given the sample, and now what the reporting, how the reporting will take place. First point, which is very important, is how much volume the semen sample should be. It should be 2 ml. What should be the pH? It should be 7.2. Okay, and what should be the semen concentration? See, I'm saying about concentration. It is about 15 to 20 million per ml. That is semen concentration. And next, total sperm value. Total sperm, how much it should be? Greater than 40 million per ejaculate. 40 million per ejaculate. Okay. And we have said about the volume, pH, concentration, total sperm, and now we say how much should be the viability. How much should be the viability? Now that is viability, life. At least 58% should be viable. Progress, motility. Motility should be at least how much? 50%. Forward progression should be there. Forward progression should be there. Viability, motility, and normal forms should be greater than at least 14% should be the normal forms. And last is leukocytes. Leukocytes should be less than 1 million per ml. Why have I have said all these values? These values are very, 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 very important. They can ask any value regarding this analysis. Okay, they'll be asking in the Viva first point. They will be asking as a 4 marks question, and they will be asking as a multiple choice question, or they may be giving a small clue in that multiple choice questions. Okay, so how much should be the volume? 2 ml. pH slightly neutral, that is 7.2. Concentration in 1 ml, at least 15 million should be there. And total sperm count, that is in one ejaculate, at least 40 million should be there. Viability, life form should be 58%. Motility, it should be forward and progression should be there. At least half of them should be motile. Half of them should be running. Okay, that is motile, 50%. Normal forms are greater than 14%, and leukocytes, that is leukocytes means presence of infection, it should be less than 1 million per ml. Okay, next. These are all our questions. Whatever I speak and write, these all are multiple choice questions for you all. Next, nomenclature. Nomenclature means, see, what is this first point? Nomenclature means some wordings we have to describe the condition. What are that words? That is aspermia. That is absence of semen. Second point, hypospermia means volume less than 2 ml. Okay? Hypospermia. Hypo means less. Hypospermia less than 2 ml. Now third is azoospermia. Azoospermia means no sperm in the semen. See, sometimes you'll be confused. What is aspermia? What is azoospermia? Aspermia means no semen at all. No semen. Aspermia. Azoo means no sperms in the semen. Okay. Now fourth is oligoazoospermia means decreased sperm count in semen. Okay, next fifth one. Polyzoospermia means count greater than 350 million per ml. Poly means more, oligo means less. And sixth one, asthenospermia. That is astheno means movement, decreased motility of sperms. Decreased motility of sperms. Seventh one. Astheno means movement. Movement. Decreased motility of sperms. Teratospermia means abnormal forms of sperms. And last is necrospermia. Necrospermia means necro means dead. Dead tissue is known as necrotic tissue. Dead sperms. Okay. They can ask any word which I have written. They can ask astheno means what? It is decreased motility. Poly means how much greater? Greater than 350 ml per m. 350 million per ml. Necro means dead. Terato means forms. Okay. All these are very important for your multiple choice questions. And the treatment always depends upon the following category. Oligo means what you'll give. For astheno, what you'll give. They'll be asking. Okay. Now we come to the treatment part. Okay. Whenever the patient comes in case of infertility, never advise him take this, that, not like that. Always infertility means counseling of a couple together. The male and female should be seated and we should speak to the couple. Okay. So they'll ask in Viva like that. Okay, there's a female will come, you'll give counseling only to the female, or a male will come, you'll give counseling only to the male. No, you should make the partner, that couple should sit and they should speak to a doctor. Okay, first assurance of the couple. No problem. Assurance of the couple, that gives that psychological boost up, so that their tension is relieved, means all the hormonal production will become normal. Okay, first point you should say is assurance of a couple is very important. Now the next point, body weight. Normal BMI should be 20 to 24. You should see whether they are maintaining, whether the male is maintaining a BMI of 20 to 24. Treat any obesity, overweight, or underweight. Okay. Now third one, stop smoking alcohol. Ask the patient to stop smoking and alcohol because they affect the sperm count. Both smoking alcohol affect the spermiogenesis. Therefore, ask them to smoke or alcohol stopping. Fourth one. If the condition is hypogonadotrophic hypogonadism. See, gonadotrophic means pituitary. Gonadotrophic means pituitary. Gonadism means testis. What we have to do? A. HCG of 5,000 international units once or twice a week. This stimulates the testosterone production. Okay, hypogonadotropic hypogonadism. Okay, and first, see, in this, you'll say a patient of some 32 BMI, what you'll advise him. First advice given to the patient is, please control your weight. Your BMI should be 20 to 24. Now, this the patient is smoking how many cigarettes per day, or taking alcohol, or so many this much. Like that, they will be explaining. You will say what advice, what the immediate advice you will give to the patient. Stop smoking alcohol. For that only, I have written these words. Okay, they can ask the questions like this. And hypogonadotropic gonadism means the pituitary and the testis both are involved. So both should be regulated now. So what you'll do first, you'll give HCG of 5,000 international units once or twice a week. Means once a week or twice a week, and this will stimulate the testosterone production. And then next again, if there is no sperm in ejaculate along with HCG, add pure FSH. You add the pituitary component and the FSH. Okay, this FSH, what it will do? It increases spermiogenesis. Okay, what happens along with HCG? Add FSG, that is follicle stimulating hormone, should be added. And if there is any hyperprolactinemia conditions, add dopamine agonist like cabergoline. Okay, cabergoline. Okay, it decreases the prolactin, increase the libido. It increases the libido. Okay, so increase hyperprolactinemia, dopamine should be given, cabergoline. And next, fifth one is in case of hypergonadotrophic hypogonadism. Here the testis is not well and the pituitary is overly functioning. There is no relation between the pituitary and the gonad testis. Therefore, what you will do in that, no medical management. No medical management. See, both the gonad is it's under and the gonadotropic, the pituitary is higher. Therefore, we can't treat this condition medically. And so, what we'll do is, in case of severe oligospermia, that is, if it is less than 1 to 5, it is maintaining 5 million per ml sperm. 1 to 5, advise IVF. Less than 1 million of sperms in an ml, go for ICSI. Okay, go for ICSI. You will advise the patient like that because the testis is not under control and the pituitary is not under control. The sperm count is very less. Advise them for IVF or ICSI. Now, sixth one. Sometimes, if there is any oligospermia, advise clomifencitrate of 25 mg for 3 months. It increases the sperm quality. Okay, you can add clomiphene citrate also. Okay, for 3 months, 25 mg. Okay, so what they're asking this is, if there is no sperm, no sperm means there are involvement of pituitary as well as the HCG. So what the HCG will be doing? HCG will be adding testosterone. It increases the production of testosterone, and the FSH, follicle stimulating hormone, will stimulate the spermiogenesis. Therefore, you should give the both of them. Cabergoline, that is dopamine agonist. Okay, hyperprolactinemia condition decreases. And if there is less than 1 million, directly go for ICSI. No doing IUI, IVF, nothing will work. Okay, less than 1 million per ml, go for ICSI. Next, if there is any leukocytospermia, then add doxycycline or erythromycin for 4 to 6 weeks until the leukocyte count is less than 1 million per ml. Add doxycycline or erythromycin for 4 to 6 weeks. Now the eighth one is sometimes retrograde ejaculation may be a problem. Therefore, in that condition, phenylephrine, that is, it is alpha adrenergic. It increases the tone and blood flow to the internal urethral sphincter. Therefore, all the sperms can be collected in urine. Okay, so retrograde ejaculation is there sometimes. You'll give phenylephrine, or what happens if you give phenylephrine? It increases the tone of the urinary sphincter or blood flow to the urinary sphincter, and all the sperms can be collected in the urine. Okay, now if you go to any surgical procedures, if there is any varicocele or any hydrocele, sometimes what happens is testicular torsion, undescended testis, sometimes they will be there. For undescended testis, just orthopexy should be done. Orthopexy will be done. And last is for genetic conditions like Klinefelter or wide chromosomal deletions. Please go for artificial insemination with donor sperms, or go for advise the couple for adoption. Okay, we all know that infertility is a very, very, very big topic. We can't go detailedly into it. Separate entity or a branch of reproductive medicine. You should all know the important points regarding it. I have already separated the male and female because you should not get confused, and we can discuss regarding the male condition detailedly. I have explained only that the investigations and the treatment. Okay, and what is the important point in this is the phenylephrine B, they will be asking, we have given this. Now, from where you will be collecting the sperms? From blood, from semen, from pus, or from urine. So, urine is the answer for it. And what are the surgical conditions are? Varicocele should be treated, hydrocele should be treated. Sometimes the patient in whom vasectomy has been done, that can be also be treated again. And last, for genetic conditions, no ICSI, no IVF, nothing. Just donor sperm should be taken. Okay, donor sperms, and then adoption should be advised. Okay, I think you all understood this topic. I have made it very, very, very simple so that you can remember. Please go through the video completely and try to answer the questions in the coming sessions. Okay, okay, thank you.